What are Alzheimer's and dementia? Alzheimer's and dementia are two medical terms often used interchangeably in everyday conversations, but they have important distinctions. Dementia is a general term referring to a set of symptoms, including memory loss, difficulties with thinking, problem-solving, or language that are severe enough to interfere with daily life. Alzheimer's disease is the most common type of dementia, accounting for approximately 60 to 80% of dementia cases. It is characterized by pathological changes in the brain, such as the accumulation of beta-amyloid plaques and tau tangles, which lead to the death of brain cells and a progressive decline in cognitive function. According to the Alzheimer's Disease International Report, over 55 million people worldwide are living with dementia, and this number is projected to reach 139 million by 2050. Why should we talk about dementia? Memory loss, difficulty performing simple tasks like cooking or managing finances, and behavioral changes such as irritability or social withdrawal are just some of the impacts of dementia on individuals and their families. Additionally, the costs of caring for dementia patients, both financially and emotionally, are substantial. The bad news is that there is currently no cure to stop or reverse Alzheimer's or most types of dementia. The good news is that with awareness and preventive measures, the risk of developing dementia can be reduced, or its progression can be delayed. What is the purpose of this content? We aim to introduce you to 10 common medications related to Alzheimer's and dementia. These medications fall into two categories: those used to manage the symptoms of Alzheimer's and dementia, and those that may increase the risk of developing dementia. We will also explore practical strategies for dementia prevention to help you and your loved ones make informed choices to maintain brain health. Durauf. Medications used to manage Alzheimer's and dementia symptoms. While no medication can cure Alzheimer's or dementia, some drugs can temporarily improve cognitive symptoms, such as memory problems, or behavioral symptoms, such as agitation or insomnia, or slow disease progression. In this section, we introduce 5 key medications used to manage Alzheimer's and dementia symptoms. Doidurth. 1. Donepezil. Donepezil, brand name Aricept, is a cholinesterase inhibitor approved for treating Alzheimer's symptoms in mild, moderate, and severe stages. It works by preventing the breakdown of acetylcholine, a chemical messenger essential for memory, learning, and attention. By increasing acetylcholine levels in the brain, donepezil can temporarily improve cognitive abilities. How it's taken: usually as an oral tablet, once daily, often at night to reduce gastrointestinal side effects. The initial dose is 5 milligrams, which may be increased to 10 milligrams after 4 to 6 weeks, or, in severe cases, to 23 milligrams. Side effects: nausea, vomiting, diarrhea, insomnia, muscle cramps, fatigue, and loss of appetite. Effectiveness: clinical studies show that donepezil can improve cognitive symptoms and daily functioning for 6 to 12 months, but its effectiveness diminishes as the disease progresses. Important note: donepezil is not approved for dementia caused by other conditions, e.g., vascular dementia, but it is sometimes used off-label. 2. Galantamine, brand name Razidine, is another cholinesterase inhibitor prescribed for mild to moderate Alzheimer's. In addition to preventing the breakdown of acetylcholine, it stimulates nicotinic receptors in the brain to release more acetylcholine, potentially enhancing cognitive effects. How it's taken: as a tablet, extended release capsule, or oral solution, taken once or twice daily. The usual starting dose is 8 milligrams per day, which may be increased to 16 or 24 milligrams. Side effects: the original text does not provide side effects for galantamine, but common ones include nausea, vomiting, diarrhea, dizziness, and loss of appetite. Effectiveness: the original text does not elaborate, but galantamine has been shown to modestly improve cognitive function and daily activities in mild to moderate Alzheimer's for a limited period. Important note: The original text does not provide additional notes, but galantamine is typically not used for non-Alzheimer's dementias unless specified by a physician. 2. Galantamine, continued. Side effects: nausea, vomiting, loss of appetite, weight loss, dizziness, headache, and fatigue. Advantage: galantamine is derived from the snowdrop flower and has a long history in traditional medicine. Improved version: benzgalantamine, Balaxur, is a new delayed-release formulation that reduces gastrointestinal side effects. Rivastigmine, brand name Exelon, is used to treat mild to moderate Alzheimer's and dementia associated with Parkinson's disease. Like other cholinesterase inhibitors, it works by increasing acetylcholine levels and is available in two forms: oral capsules and a transdermal patch. How it's taken: capsules are taken twice daily, with food to reduce gastrointestinal side effects, or a transdermal patch is applied once daily. The usual starting dose is 1.5 milligrams twice daily for capsules, which may be increased to 6 milligrams twice daily. Side effects: diarrhea, dizziness, headache, nausea, increased bowel movements, and skin irritation with the patch. Advantage of the patch: the transdermal patch causes fewer gastrointestinal side effects and is suitable for patients with swallowing difficulties. 4. Memantine, brand name Namenda, is a glutamate regulator prescribed for moderate to severe Alzheimer's. Glutamate is a chemical messenger involved in learning and memory, but excessive amounts can damage brain cells. Memantine prevents this damage by regulating glutamate activity. How it's taken: available as tablets, oral solution, or extended-release capsules, taken once or twice daily. The usual starting dose is 5 milligrams per day, which may be increased to 20 milligrams per day. Side effects: dizziness, headache, constipation, confusion, and diarrhea. Combination use: memantine is sometimes prescribed with donepezil as the combination drug Namzaric for enhanced effectiveness. 5. Lecanemab, brand name Leqembi, is an anti-amyloid drug approved by the FDA in 2023 for the treatment of early-stage Alzheimer's, mild cognitive impairment, or mild dementia. It works by binding to and removing beta-amyloid plaques from the brain, slowing disease progression. How it's taken: intravenous infusion every 2 weeks in a medical facility. Side effects: infusion-related reactions, e.g., fever or chills, headache, and the risk of serious complications such as brain bleeding or swelling. ARIA. Significance: lecanemab is one of the first disease-modifying drugs that can slow cognitive decline by up to 27%, according to clinical trials, but it is only effective in the early stages. 6. Donanemab, brand name Kisunla, is another anti-amyloid drug approved by the FDA in 2024 for early-stage Alzheimer's. Like lecanemab, it targets beta-amyloid plaques and can slow cognitive decline. How it's taken: intravenous infusion every 4 weeks. Side effects: similar to lecanemab, including infusion-related reactions, headache, and the risk of ARIA. Difference from lecanemab: donanemab may clear amyloid plaques more quickly, but requires close monitoring. Vorexant, brand name Belzamra, is an orexin receptor antagonist used to treat insomnia in Alzheimer's patients. Insomnia and sleep disturbances are common in these patients and can worsen cognitive and behavioral symptoms. How it's taken: oral tablet, taken once daily, 30 minutes before bedtime. Side effects: daytime sleepiness, headache, dizziness, and unusual dreams. Significance: improving sleep can enhance the quality of life for both patients and caregivers. DARS. 8. Brexpiprazole, brand name Rexulti, is an atypical antipsychotic approved for treating agitation in Alzheimer's patients. Agitation, such as shouting or aggression, is common in moderate to severe stages. How it's taken: oral tablet, taken once daily, with an initial dose of 0.5 milligrams that may be increased to 2 milligrams. Side effects: sleepiness, restlessness, weight gain, and an increased risk of mortality in elderly patients. Black box warning. Note: this drug should only be prescribed under the supervision of a specialist physician. Everyday medications associated with an increased risk of dementia. Certain medications commonly used to treat other conditions may increase the risk of developing dementia. These drugs are often taken long-term without awareness of their potential risks. In this section, we will review 5 key medications. 1. Anticholinergic drugs. Anticholinergic drugs reduce the activity of acetylcholine in the brain and body and are used to treat conditions such as allergies, insomnia, depression, or bladder issues. Long-term use of these drugs is associated with an increased risk of dementia. Examples: diphenhydramine, Benadryl, used for allergies or insomnia. Amitriptyline, a tricyclic antidepressant. Oxybutynin, used for overactive bladder. Mechanism of risk: reducing acetylcholine, which is essential for memory, can impair cognitive function. A 2015 study in JAMA Internal Medicine found that long-term use of these drugs increases the risk of dementia by up to 54%. Recommendation: avoid long-term use and consult a doctor about alternatives, e.g., loratadine for allergies. 2. Benzodiazepines. Benzodiazepines are used to treat anxiety, insomnia, and muscle spasms, but long-term use is linked to cognitive decline and an increased risk of dementia. Examples: lorazepam, Ativan, diazepam, Valium, alprazolam, Xanax. Mechanism of risk: these drugs enhance the activity of GABA, an inhibitory neurotransmitter, which can impair memory and learning. A 2014 BMJ study found that benzodiazepine use for more than 3 months increases the risk of Alzheimer's by up to 51%. Recommendation: avoid long-term use and consider non-drug options, such as cognitive behavioral therapy, CBT. 3. Proton pump inhibitors, PPIs. Proton pump inhibitors are used to treat acid reflux and stomach ulcers, but long-term use may increase the risk of dementia. Examples: omeprazole, Prilosec, pantoprazole, Protonix. Mechanism of risk: these drugs may reduce vitamin B12 levels or increase amyloid accumulation in the brain. A 2016 JAMA Neurology study reported an association between PPIs and an increased risk of dementia. Recommendation: minimize use and consult a doctor about alternatives, e.g., H2 receptor antagonists. 4. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are used to relieve pain and inflammation, but some studies suggest a link between long-term use and an increased risk of dementia. Examples: ibuprofen, Advil, naproxen, Aleve. Mechanism of risk: chronic brain inflammation may be exacerbated by long-term NSAID use. However, evidence is conflicting, as some studies suggest NSAIDs may have a protective effect. Recommendation: avoid unnecessary or prolonged use and consult a doctor. Dursulfder Reese. 5. Opioids are used to manage severe pain, but long-term use can impair cognitive function. Examples: oxycodone, OxyContin, hydrocodone, Vicodin. Mechanism of risk: opioids can cause brain fog and reduce cognitive performance. A 2019 neurology study reported an association between opioid use and an increased risk of dementia. Recommendation: use non-opioid pain management methods, such as physical therapy when possible. Varginserter. Strategies for dementia. Prevention. Preventing dementia requires a multifaceted approach that includes a healthy lifestyle, management of chronic conditions, and cognitive stimulation. Below, we explore practical strategies. 1. Healthy nutrition. Nutrition plays a key role in brain health. The Mediterranean diet, rich in fruits, vegetables, whole grains, fish, and olive oil, is associated with a reduced risk of dementia. Recommended foods: fatty fish, rich in omega-3, salmon, sardines, nuts and seeds, walnuts, almonds, leafy greens, spinach, kale. Supplements: omega-3 and vitamin D may be beneficial, but evidence is not conclusive. Restrictions: reduce sugar, trans fats, and processed foods. 2. Exercise and physical activity. Regular exercise increases blood flow to the brain and stimulates the growth of brain cells. Recommendations: 150 minutes of moderate aerobic exercise, e.g., brisk walking, per week. Resistance training, e.g., weightlifting, twice a week. Yoga or Tai Chi for balance and stress reduction. Evidence: a 2020 Lancet study found that regular exercise reduces the risk of dementia by up to 30%. 3. Quality sleep. Sleep is essential for clearing toxins, e.g., beta amyloid, from the brain. Chronic sleep deprivation is associated with an increased risk of dementia. 3. Quality sleep continued. Recommendations: aim for 7 to 9 hours of sleep per night. Maintain a regular sleep schedule. Avoid caffeine and screens before bedtime. Evidence: a 2021 study in Nature Communications found that insufficient sleep in midlife increases the risk of dementia. 4. Cognitive activities. Stimulating the brain through learning and social activities can enhance cognitive reserve, which helps protect against cognitive decline. Recommendations: learn new skills, e.g., playing a musical instrument or a new language. Engage in puzzles, Sudoku, or brain games. Participate in group activities like book clubs or volunteering. Evidence: a 2019 neurology study showed that regular cognitive activities reduced the risk of dementia by up to 20%. 5. Managing chronic conditions. Chronic conditions such as diabetes, high blood pressure, and high cholesterol increase the risk of dementia. Recommendations: control blood sugar, blood pressure, and cholesterol through medication and lifestyle changes. Schedule regular medical checkups. Maintain a healthy weight if needed. Evidence: a 2020 The Lancet study found that managing high blood pressure reduces the risk of dementia by up to 15%. Conclusion and practical tips. Dementia and Alzheimer's pose significant challenges for individuals, families, and communities. But with awareness and preventive measures, their impact can be reduced. In this guide, we explored 10 everyday medications related to Alzheimer's and dementia. 5 drugs: donepezil, galantamine, rivastigmine, memantine, lecanemab, used to manage symptoms, and 5 drugs: anticholinergics, benzodiazepines, PPIs, NSAIDs, opioids, that may increase the risk of dementia. We also provided practical strategies for prevention, from nutrition and exercise to sleep and cognitive activities. Practical recommendations for you: discuss your current medications with your doctor and be aware of their long-term risks. Adopt a healthy lifestyle. Maintain a balanced diet. Exercise regularly and get enough sleep. Keep your brain active. Read books, learn new skills, and stay socially connected. Manage chronic conditions and attend regular medical checkups. We invite you to share your experiences and questions in the comment section of our YouTube channel. Have you or your loved ones faced dementia? What prevention strategies do you use? Your insights could help others.